But now, how we collect data, what we should do, or what are the worldwide systems that I'll be speaking about. It is important to know that in general, there is a worldwide increase in incidence of psychiatric diseases. And of course, about referral to medical doctors or any health care institution, we do not have too much referrals. People are not applying for or asking for any service. It could be due to not having enough number of mental health care providers. Maybe time is limited during the sessions, and there is actually also a low perception that the treatment would work. That's the reason why. But of course, on the other hand, the assessment of mental health disorders, about diagnosis and treatment, there is the need for some innovative methods. They have to be affordable, cost-effective, and they have to be highly scalable. Of course, especially all these methods, both for diagnosis and treatment, they actually should be providing too many alternatives. As you all know, there are several studies related to use of technology in psychiatry. What do we mean by highly scalable solutions? There must be such a system that actually should adapt to increasing demands and loading. So it should be able to have access to more number of users and process at the same time more data and manage as well. After digitalizing the system, it could be either web-based or cloud-based, or also some internet-based applications can be used for this. About storage of such data and use of the data as well, it is possible to have a platform, a system, especially recently. Looking at the diagnostic tools and the assessment tools, as you would appreciate, we have huge pile of data in front of us, and you have to assess the data in hand so you can actually move to a further step. But it is possible only by way of AI or machine learning that we can handle that much huge amount of data. Digitalized skills, first of all, it is the simple, for example, pencil paper tests, pen paper tests. Since the beginning of 90s, they've been digitalized, but after 2010, we know we actually have more digitalized skills being used, and the others are adaptable. Again, interviews performed or questionnaires. What is the point on this? It could be short questions. Or let's assume, for example, you ask a question, yes, no, then you can skip. Let's assume, with regards to psychiatric condition, if, for example, reply as no to the question, can follow the others. You don't have to ask all the questions with regards to depression, for example. Or for these questionnaires, again, it is possible that they can reply anytime. It could be over the tablet, it could be smartphone, it could be a computer, so they can use their own personal devices. Now, there is also a technical side of it. Maybe it sounds like it is not a big deal. I mean, you know, the pencil paper test can possibly be on paper. Once you put it on the digital environment, it is exactly the same thing. No, that's not the case. There is the interformat reliability. That is the term. And for a questionnaire or for a scale, there is the hard copy and the digitalized form. You make a comparison. That's what we mean by interformat reliability. There are studies performed for this purpose. This is a systematic review, and 33 studies included. And out of these studies, what is mentioned is the interformat reliability is found high in several studies. What I mean is a scale, for example, a questionnaire between the hard copy format and the digital format, there is no major difference. So both can be used. Of course, you have to apply some different technical methods to be able to do so. It is mostly, for example, inter-class comparison, intergroup comparison. And to measure this, you check the correlation of both groups, both the pen paper version and the digital version, looking at the correlation. On the other side, the difference in mean scores, you have to check for that, so as to understand the interformat reliability of a study. Why it is highlighted? Because in all studies performed, this may not be reliable enough, and so it's a significant issue. In the studies performed, there is also one thing that we should pay attention. Let's assume we have a questionnaire scale, and there are different subgroups or subfactors. Again, if you convey them to the digital platform, there could be some differences in the factor structure. So you also have to assess this, but in majority of the studies, as you can see, there is actually a high interformat reliability. But in some of the studies, not performed, not achieved, so you have to pay attention. Another point in assessing the scales, besides that, about the reliability of the therapeutic methods, there are studies. In a systematic review and meta-analysis, CBT assessed, both in face-to-face therapy and also digital therapies. And it is 1,053 individuals. It is quite a high number. And especially for the interviews, I mean, they're as effective as the face-to-face interviews. For example, the therapy performed on the internet, over the internet, is as effective as the face-to-face treatment. I mean, what we're trying to do is adopt the therapeutic methods to the internet, make it internet-based, but plus the instruments and the tools that we are using, so they are both valid. Another systematic review, it's quite recent, published in 2022, and 28 studies included in the systematic review. Depressive disorders, 8 studies, generalized anxiety disorder, 12, panic disorder, 7 studies, but bipolar spectrum disorder, psychosis, or eating disorders, just 1. And also for ADHD, 1 study. And there are also instruments and studies used for this, but they're not enough. And there are some missing points in the literature. This is just one of the studies in the systematic review. What I'm trying to say is, for example, depressive disorders, GAD, and over the tests and the already existing scales that we are using, the number of questions vary. In one, for example, 382, in the other, 2 only. The reference tests, again, mostly over SCID or DSM-4. Between the index text and the current tests, there are some differences in the time the test applied. For example, some of the tests performed on the same day, others not on the same day. So this is actually reducing the efficacy of the assessment. What is mostly underlined is that in majority of these studies, they focus only one condition, only anxiety, only depression, only psychosis, for example. But for a more comprehensive mental health assessment, a combination of these instruments is a must. That is the recommendation according to the systematic review. Another, again, conclusion out of this systematic review, only one actually test has sociodemographic questions. Therefore, as you all know, in dimensional or more comprehensive assessment, there is actually the need to screen different psychiatric disorders, but at the same time, some other factors associated with mental health must be included. As I told you, some of the tests can be adopted. I mean, after, for example, you answer the question, you can either continue or skip. And this, in particular, is both for the clinician and the patient, actually can save more time. So whatever the relevant symptoms are, it is possible to collect data accordingly. From the technical perspective, this is a systematic review from 2016. This is the validation of online psychometric instruments. 56 studies included and 62 different online instruments assessed. For depression and for anxiety, the psychometric properties are adequate, mainly for this. There's a critic as well in here. 62 different online instruments, but only a couple of those, once assessed from psychometric perspective, it is possible to get enough data. Here is another example. You can see different instruments in here. Some are checking for the symptoms, some others symptom severity and screening. For example, G, looking at the population, it is the general population, collect data. The other only female, some student, some veterans. Therefore, in compiling the data as an overall assessment, it could be a problem. On the other hand, majority of those tests performed in the United States. From Sweden and the Netherlands, there are some also studies, also the UK, but majority of those are performed, the tests are performed in the United States. So, psychometric assessment, internal coherence, factor coherence or consistency of the tests, the internal or area under curve, or through some statistical methods, also internal consistency assess. As you can see, some of those actually have consistency, but some others do not have. I mean, not possible to say anything about reliability. All these questionnaires, once digitalized, they can actually reduce cost because hard copy has more cost. But with less cost, it is possible to ask people to do the questionnaires. But in parentheses, maybe it's a debate where we are going to apply the test, whether home or in a clinic. Why? Because it may vary. I mean, the results may vary. And I forgot to mention previously, in this study, in this systematic review, what is underlined is that it is possible to have accessibility for too many, but there's, for example, nothing that smartphones are used as an application for performing these tests. What are the pros for us? The results, the responses are automatically saved, so you can have access immediately. It's okay, we are saving the data, it's important, but also you have to analyze the data. So it will be very useful to have such an opportunity. It is easy for the participants. They can do it over the internet at home, which is good. But of course, it should not be like I start filling the questionnaire one day and then 2 days later I did the rest of it. This should not be the case. I mean, they have to do it from the beginning to the end. It's possible to standardize assessments as an advantage. In terms of data loss, in terms of data storage, it's important. And also, we have better capacity for compiling data, in particular, confidential data. Because it is important to actually have a barrier for access. I mean, no one should have access to this. So another topic discussed. It's good for saving time, both for the clinician and the patient. They can do it at their own pace. Once data collected, it's possible to save them, to retrieve them, or use them for future comparisons. One important thing about these assessments, once you look at these instruments one by one, as they focus on one single condition, what is recommended is that they have to be considered as a whole: psychosis, bipolar disorder, or anxiety disorder. It could be social phobia, generalized anxiety disorder, or eating disorder, or alcohol and drug use, or ADHD. I mean, you should be able to assess all conditions because of a dimensional approach. On the other hand, one thing that is missing in here is, while screening for risk for any condition, also the other personal factors, social factors, or in, for example, genetic history, must be also questioned, so we can have actually a more comprehensive approach for assessment. So thank you.